Hey everyone, Robert here. It's May 8th, 2020, and I found this County of Ventura press conference over the COVID-19 that is going on in their county. Now, they go through the usual rigmarole of introducing different people, but it was this Dr. Levin that interested me with regard to a subject that we're going to cover today, and I'll go ahead and play that for you now.
It's not just our county that's bringing more people on. There are going to be thousands of people hired who will be these contact investigators throughout the state. And this is occurring in many, many other states as well, perhaps all of the states in our country.
Okay, so it got me on the whole thing with regard to contact tracers, and this is going to be a phrase that we are going to be hearing more and more and in the coming months if we haven't already heard of it anyway. Now, contact tracing is nothing new, and all the links that I'm going to be talking about here are going to be provided in the description down below this video on YouTube. Now, contact tracers are not a new thing. They have been around for decades. Contact tracers, what they do is they are a group of individuals, usually from the health department, that are set up to investigate people who have contracted diseases. In this case, the coronavirus, COVID-19. And what they do is that if an individual has been infected with this, they find out they interview them with a questionnaire. When did you contact it? How long do you think you've had it? Have you been around people? It is tracing the contact of the infected individual to find out who might be infected. And then what these contact tracers are going to be doing is they're going to be contacting all of these individuals via phone. It will be a very private thing. It's not going to go public in any way. Now, I have no problem with the contact tracers. They have been around since polio. Whenever the HIV epidemic first hit this country and the world, they had contact tracers. They've had contact tracers still going on in different areas of the country and the world. The thing that we are seeing now, and the reason why we're going to be hearing more about this, is because COVID-19 is a worldwide pandemic. And there are certain things with regard to what is happening with contact tracing that have me a little bit concerned. First and foremost, they're going to be hiring a bunch of people. Now, I have no problem with lay people being hired. They are going to be trained. And basically, the tier or the setup of all this is going to be one clinician, usually an RN or a nurse of some kind or a doctor, that is going to be heading up a particular group. That doctor is going to oversee one lead individual within a group of about 5 to 10. So it's going to be going on not only in this county that this doctor was speaking on, but also in multiple counties, and it'll probably be in a county near you. Now, these people are going to be trained. They're going to be gathering data, contact information, basically it'll be like Census Bureau type of thing. How many people are in the household? What are the ages? What's the gender? Do you work? Where do you work? I mean, in a past video with Governor Cuomo, he was talking about contact tracing, and they were asking for demographic information, which gets into an interesting thing of getting more information that may be necessary. Now, the thing that bothers me about this is that if individuals are, whenever a contact trace is being presented, if an individual is being belligerent or doesn't want to give up that information, they are to be referred, or the contact trace interviewer is going to refer to their supervisor. And from the CDC, they said that measures or authorities may be used to keep the individual isolated, and it is going to be given to the health organizations, the Department of Health, for all of these different counties, cities, towns, all of that stuff, to determine if an individual needs to be, well, let's just say, forcibly isolated. But it even goes beyond that. We are getting into instances where They are doing wraparound, this is what they are calling wraparound services for the people who are isolated. Do they need groceries? Do they need extra income? Do they need laundry being done because they're being isolated? I don't have a problem with that. Where my problem came into being is that whenever I was researching this and I was looking on the CDC for training individuals for people that want to be contact tracers, and they are going to be hiring these people, it is going to be a job for probably a great many people. These contact tracers are going to have some pretty interesting training that's going on, which gets into this third part. Now, Dr. Mike Reed is out of San Francisco, and this epidemiology grand rounds is part of the training video that is on the CDC's website. Again, links will be in the description. Now, the interesting thing that happens in this training resource, which will be watched either this one or something very similar to this by individuals who want to be contact tracers, is this portion right here. And I'm going to go ahead and play this for you.
I think there are things that we're interested in thinking about. Is there a way to enhance the precision of contact tracing by having options for contacts to give us their contact list so that we can do a better job of reaching people? Could we use publicly available data, for example, DMV records, etc., to better contact those individuals for whom we don't have a phone, but we know that they live with somebody, etc.? Are there better ways to rapidly connect contacts to testing capability, either to drive-through testing or home testing capabilities? Certainly the home testing piece is something that Gates Foundation has funded in Seattle. And as I've mentioned now in the slide before, are there better ways that we could support people to quarantine with less effort? Next slide.
Now, the fact that they are thinking or wanting or considering connecting the contact tracing information to get more information, DMV records and things of that nature, is a little disconcerting. The information is out there for a government agency to be able to pull up data on anyone that they want, but what they have done and what they are planning on doing, and I think that this is a plan that's going to be implemented, is that the Department of Health within different townships, within different counties, they may be able to get access to records and databases that they wouldn't normally have. This is bothersome, and this is done all in the name of COVID-19, the coronavirus pandemic, to keep people safe and to be able to gather contact information. Folks, contact information is needed in a contact trace. Now, I am not speaking out against getting that contact information. People should have a choice as to whether to give that up. But it's done in the name of safety, and this has been going on for a while. What bothers me about this instance, and Dr. Mike Reed, what he has said is that he is wanting to link up the Department of Health, which will also go into the CDC, to Department of Motor Vehicles and to other databases and things that they wouldn't normally have access to. But it goes a little bit beyond that, and we'll take a listen to the next slide.
So clearly, it goes without saying that there are tremendous research opportunities here, and I think we're just starting to think about what some of the research questions are that we could be asking. You know, we're going to have a chance to track all of these contacts and see who develops symptoms and when. We'll be able to better understand predictors of disease and severity. The DiMaggio app will allow us to geographically map contacts, which will obviously give us a textured understanding of disease transmission. I think there's really important research to be done around social networking and understanding disease transmission. And clearly there are some great implementation science questions that should be answered quickly. We're hoping to mobilize a workforce of librarians who are twiddling their thumbs right now, unable to work here in San Francisco. How good are they at contact tracing? My guess is that they're a lot better at doing it than I will be, given their fidelity to rules and surveys, etc. But it will be interesting to look at that kind of question. And overall, how could we use this platform to better improve the efficiency of of our efforts. Again, I think there are really interesting behavioral economic questions as well. What kinds of incentives could we put out there for to ensure successful quarantining? And these are questions that hopefully DPH, in partnership maybe with UCSF, we can answer in the weeks and months to come. Next slide.
I think those two things really concern me. One, the fact that they would be using librarians. Now, I know a lot of you maybe thinking, well, who goes to the libraries anymore? The fact that librarians have an access, and I'm speaking from the standpoint of a librarian who used to catalog books, I used to have access to a database that individuals, whatever their reading habits are, whatever all that stuff, and these are hubs of information for databases where people can come in and they can do contact tracing. Now, what really bothers me is that the gathering of more information, or I should say what Dr. Reed wants to do is to gather more information on top of the things that are going on with the contact tracing. We're getting into behavioral economics, and this thing really creeps me out. Behavioral economics started back in the 70s and is one of the more listened to of the social science. It basically is looking at the psychology of individuals and how they spend and how they move their money around. When you understand behavioral economics, you understand how to motivate people to do or to not do a specific thing. And behavioral economics, as far as creating incentives for people to stay self-isolated. In other words, putting the carrot on the stick as to control a segment of the population within the different areas. Folks, whenever I was a marketer online, if I had more information about a particular group of individuals, I knew what I could write, I knew what I could put up, I knew what I could put in video and all that stuff to be able to make people do things that I wanted them to do and not do things that I didn't want them to do. This type of data gathering, and this is the thing that really bothers me, and the fact that this is going into a CDC database, it's a government database, the fact that we are giving more profile information and more of a psychological profile, this is the thing that really bothers me with regard to contact tracing. And the fact that they are incorporating citizens to be able to keep track of their neighbors, to be able to investigate the people around them, to make sure that they are being good little citizens and isolating for a disease that has a mortality rate of less than 0.03%. This is troublesome, to say the least.